Hello, I'm Gary Bebow, and this is our January CEO Connection. The standard of the month for January is honesty and integrity. You know, it goes without saying that we need to have honesty and integrity in our dealings with others, and likewise, we expect them to be that way with us. So for the month of January, please pay close attention to being honest and have integrity as we interact with ourselves and our fellow employees and patients, and likewise, let's expect that of others when they deal with us. There's been a lot written and discussed lately about our entry into the satellite emergency room in Sharp County. You know, we've been providing care to North Sharp County for over 25 years now, and we believe the best way to solve their ongoing issues in access to medical care is a satellite emergency room. Now, in Arkansas, there are no other satellite emergency rooms in the entire state. You know, it's a lower cost, more viable solution from a regionalization of healthcare perspective, and we're going to do our best to implement a great program there that serves that community. Now, we do have opposition. There is a group in North Sharp County that wants to build another hospital. We don't believe that's the right solution for North Sharp County, and yet there will be a lot of more discussion and a lot more debate in the upcoming couple of months. So we're going to move forward with building our satellite emergency room. It'll have 7 exam rooms. It'll have connection with our emergency room here in Batesville. And I hope that you'll get behind this and support us in that, in our approach to provide better and greater emergency room care in North Sharp County. So more to come on that, and in future CEO Connections, I'll talk more about it. So in 2012, there was an employee campaign that focused in on you supporting us in our expansion of our emergency room at White River Medical Center. Well, you know, a lot has happened over the last year, and we found that a significant reduction in emergency room volume has occurred at White River Medical Center, but also all over our country. So that's made us decide to pause and reevaluate just what we're going to do in our emergency room. Now, I've been asked the question, are we going to do any renovation or expansion of the emergency room? And the answer is yes, we are. But will it change in scope? Yes, it will. So we're going to be looking at how do we best take care of patients. Do we have the rooms back there the right size? Can the existing layout be changed to improve on patient flow and patient amenities? Is there a better way to provide patient care so that we just do a better job of serving the public? So over the next few months, we'll be re-looking at those plans. Once we get those completed, we'll display them and show them to all of the staff that were so important in that campaign of a year ago. You know, with the way the healthcare reform is happening right now, we're always going to have to reevaluate what we're doing, what our strategic plans have been in the past, and the expansion of the emergency room is just one example. So over the next couple of months, I'll be changing some of those plans and communicating those as those plans become more clear. I want to make a few comments regarding the closure of 2013. You know, 2013 was a very tumultuous year for healthcare in general, and in particular at White River Medical Center. Like other hospitals throughout our state and throughout our country, we've seen decrease in patient volumes. We've seen increased emphasis on patient satisfaction, the importance of subscribing to and adhering to evidence-based medical care. We've seen a greater emphasis on reducing costs and improve efficiencies. And when asked what can we expect in 2014, I'd say you can expect the same thing again. In the latter part of 2013, we underwent a health readiness assessment consulting study that took a look at what we've done so far to prepare ourselves for health reform and to identify those areas where we got to get better. Now, that study will be released in the early part of January, and in that study, it will identify those things that we must prioritize for the upcoming 6 months to a year to 18 months. Once that study is completed, I'll communicate some of the highlights with you in upcoming CEO Connections. But clearly, we can expect to do some of the very same things in 2014 as we have in 2013. We've got to work on those things that can increase our patient volumes. We've got to improve our ability to provide high patient satisfaction. We've got to adhere to the best quality of services that we possibly can, get the best outcomes we can with patients so they'll feel comfortable in continuing to use us. we've got to look at ways to decrease our costs, improve our efficiency, and we just got to continue to be mindful of our community and provide the very best care we can in our community to improve its health. So maybe as this next year unwinds, we'll have a better understanding of just what's going to happen at both the state and the national level. And as those things become more clear, I certainly will communicate those with you. So thanks for everything you've done this last year. We've had a great year, I think, and yet there's a lot of areas that we still got to improve on. So I hope your holidays have been blessed and festive. Hope you'll be safe, and we'll see you next year.